Hey everybody, what's going on? This is Dr. Eric Reese, one of the migraine mentors at the Migraine Mentors newsletter, and this is our Migraine Mentors minicast. This week I'm really excited to talk about this. I just had an awesome case roll through my office. I've been working with her for about 2 or 3 months, and Sarah's just done phenomenal with managing her migraine symptoms, where she was at the point when I started working with her where she was taking her 9 Imitrex within 10 days. And now she's at the point where she's only taken one over the last month, which is a remarkable change in transition. And I want to talk a bit today about that. It's not necessarily just about Sarah's transformation, but I want to talk about why I really truly believe personalized medicine moving forward is going to be far more effective and far greater at helping people than conventional medicine. Now, I need to say that with a bit of a grain of salt because it's not that I don't believe in conventional medicine or maybe even Western medicine, right? Because I do. I genuinely do. I think, especially in the migraine community, taking SSRIs, triptans, CGRP agonists, you name it, these things are absolutely amazing with being able to help people prevent migraines and also treat them. I think the biggest problem that I'm running into clinically and from the research and the data is the fact that I feel like that's the only avenue people are pursuing or think that they can pursue. And the problem with that is it's one, not true, but two, if that's the only path forward, then there are so many people out there. And I'm sure there are people listening to this who are like, listen, I've done all that and I'm still struggling with migraine issues. So what's next? The next wave of healthcare and health innovation is going to be on the personalization front, right? And it's not even just saying, oh, personalized medicine or functional medicine. It's like using my Apple Watch data to tell me about how my sleep metrics are and what did I do last night to get better sleep versus not. It's about utilizing different personalized blood tests and stool sampling and these different analyses, even things we can do in the clinic, like a bedside neurological exam. It's putting all of these things together in an integrative format to say, here's what's working, here's what isn't working, here's what we need to help you do to help you update your software and move forward from there. So let's pick that apart a little bit. I think the first thing that people need to understand is that you are not a textbook, you are not a study, you are not a research paper. A lot of times these double-blind placebo-controlled studies are performed because that is the scientific method, and that's one of the best ways for us to get answers. But you're not a statistic. You never have been, you never will be. And I think conventional medicine a lot of times will just treat you with a standard template or a protocol, and they'll make you feel like you are a number, unfortunately. And where I really have an issue with that, especially with patients that I find where it's like you've been treated with all the templates and protocols, and no one's been able to help you. And then all of a sudden we start digging in and saying, oh gosh, you have an MTHFR mutation where you're a poor methylator, or your homocysteine levels are really high and we need to get those down. Or, oh my gosh, I didn't realize you had an autoimmune condition and your immune system is literally attacking your own thyroid. Like, I find these things clinically all the time with patients, whether or not they have migraine symptoms or they're dealing with concussions or dizziness and vertigo. I mean, the list goes on. And it's frustrating. And it's frustrating for patients. It's frustrating for doctors. We want to get improvements. We want to see patients get better and then hopefully live their lives. And so I think this personalized wave is really going to be so helpful for so many people. And as a patient, you need to know and understand that you can ask for this. In fact, you should be demanding it from your doctors to say, listen, I want to get some data. I want to use information and tools and objective markers to actually quantify where I'm at, where I'm going, and the changes that occur with it. I can't tell you how often these data points are so impactful and helpful for patients that I'm working with. Because one, it keeps me honest with the protocols that we're working on, but then two, patients get to see the progress over time. Progress is not like day to day, week to week. It's like more like month to month. And you'll see changes over time, but sometimes you forget where you start and where you end up. And it's just a tale as old as time. And that's why I really believe this whole personalization is going to be so important and so effective. And so it really does start with you as the patient, being your own advocate, asking your doctor to say, I would like to run this specific blood panel, or based off of the symptoms that I'm dealing with, let's look at X, Y, and Z markers. It's important for you to say, hey, can you just actually do an overall neurological and structural examination on me? Can you look at my eyes? Can you look at my inner ear? Can you do a full cranial nerve exam? Things that your doctor will look at you and say, oh my gosh, like maybe I haven't done these in a long time with any of my patients, but they'll look at you and say, okay, you're clearly educated and you have enough knowledge to be able to ask the questions to get the answers you're looking for. That's huge for you. And more importantly, it's okay for you to challenge the thinking of your doctor. I tell my patients all the time, I want you to ask questions. I want you to go search on Dr. Google and find things and then come to me and we can have a conversation about them. Doctors who don't want patients to ask questions have massive ego issues. And more importantly, too, they just think they know everything and it's their way or the highway. What I'm going to tell you is that in the 10 years that I've been in practice, I think I know less today than I did when I started. And when I started, I thought I knew everything because clinical practice has taught me that there's so much for us to learn and adapt and take into consideration. And that patients have taught me so much more than I could ever get in a textbook. And so, one, not only is it important to build that relationship of trust and of liking somebody and being able to ask those questions, but you're in this together with your doctor. And that to me is a massive part of the personalized medicine approach to care, is realizing that that relationship is so important for you. It isn't transactional. It isn't just saying, oh, we only have 10 minutes to work together. Tell me your stuff and I'll give you a script and you're out of the way. Or even seeing a chiro where it's like, oh gosh, I'm going to see you. We're going to adjust you and get you out of here. Like, I don't believe in that model because are you really changing anything that sets you up to come into that situation in the first place? If you're always dealing with neck pain and neck tension and you're hunched over your laptop, always working on things, and I come in and I am a PT and I give you an exercise, or I'm a chiro and I give you an adjustment, or I'm an MD and I give you a script for pain medication. Am I changing anything about what's setting you up for all of those issues in the first place? I would argue no. I have to educate you and empower you and show you how to change your habits in your life to get to the point where you're getting the outcomes you're looking for. And I get frustrated when I see patients come in. They're like, I've seen all these docs. I've spent $10, $20, $50,000 on all these care and treatment plans and programs. And I haven't gotten anywhere. And I'm like, where is the sensibility in this? Personalized medicine is all about you. It's about the person. It's about understanding what works, what doesn't work. It's using educated trial and error tactics, using the scientific method to say, here's my hypothesis. Here's what I think is going to work well. Here's what did, here's what didn't. Here's what we've learned from it. And then we take those learnings and we adapt and move forward with that. You deserve that, especially for somebody who's been dealing with chronic migraine or chronic headaches. Those are obviously different, but they're a lot of times encompassed in the same conversation. You deserve that. And if you haven't had that, then you need to find somebody out there who will treat you like the individual that you are. Now, I'm grateful that patients are finding us at the Neural Connection in our clinic in Minnesota, but that doesn't mean I'm the only person that could ever help you or fix somebody. There are doctors all throughout the world who are doing this on a daily, weekly, monthly basis. You just have to find somebody who you trust, who cares about you, and who's willing to look under the hood and spend the time, energy, and effort needed to figure you out. I hope that this lesson and this little quick mini podcast was helpful for you to understand that your mindset is key, but personalized medicine is the wave of the future, and you should be demanding that from every single doctor that you see. If you have questions, throw them in the chat, throw them in the comments, shoot us a DM. You know where to find us. More importantly, too, if you're not following us, the Migraine Mentors newsletter, go click the subscribe link in our bio below. And we're hopefully going to be able to deliver some great tactics and some great education moving forward for you. 2025 is going to be a big year for us. We're hoping to help a lot of people in the process. Once again, my name is Dr. Eric Reese. I am one of the Migraine Mentors for the Migraine Mentors newsletter. And this was the Migraine Mentors minicast. We'll see you at the next episode.